Stay tuned as On Call Television answers your questions on dental care. Funding for On Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. Years ago, most people lost their teeth by middle age. Today, thanks to improvements in dental care, more people are keeping their natural teeth throughout their lifetime, which makes oral care more important than ever. We brush up on dental care as the doctors are on call tonight.
Welcome to On Call Television and happy Halloween. Tonight our topic is, you guessed it, dental health. As a kid growing up, I can hardly remember a visit to my dentist, Doc Slate, that did not involve more cavities and more fillings. I don't think I was very good at brushing those early years. I cannot blame my folks because they did their very best to encourage me, but my teeth were simply not on my highest priority list. Now as an adult though, I am paying the price for those early years of inattention, and although I have regular cleaning and checkups with my hygienist and my dentist, I have had cracked teeth, caps, root canals, and even adult braces. So far, no implants or dentures, but I will likely experience those as the aging process continues, and I hope it does. Society has relegated the health of our teeth to a whole separate field of healthcare from that of my world. And I must say, I have only minimal understanding of the details of the scientific-based world of dentistry. I know they are advancing in the fields of implantation, of dentures, and of mouth care in general. I know I have a lot of questions, and tonight we have experts to help us with these questions, Drs. Prouty and Amber Meyer. So let's hear a little bit about where you're from. We'll start with you, Amber. You're from where originally?
I'm from Alcester, South Dakota.
Alcester.
Yep. South of Sioux Falls.
Yes.
Yep.
And you did your undergraduate work and graduate work?
USD is where I went to undergrad in Vermillion, and then I went to University of Nebraska Medical Center for dental school in Lincoln.
And then you now are practicing dentistry
in Watertown,
in
South
Watertown
Dakota.
with Brian.
Yep, with Brian. Yep.
And Brian, you're originally from?
Haiti. Sorry, I'm going to Haiti after this.
Yes.
Haiti. So I'm from Haiti, South Dakota, and I did my undergrad here at SDSU, and then I went to Marquette for
dental school.
Yep.
And then you did more. You've done some implant.
Well, then I've had implant training at the Medical College of Georgia, and then I also have in the Mish Institute that in Florida as well as in Chicago.
And you are going to Haiti right after
I am
this.
going to Haiti.
So let's talk
about that. So
yeah, your missionary work. How often do you do that?
Well, you do that about every 6 months, and that's why this whole crew out here is with me. We go down there and we stay at an orphanage, and it's a great experience. I get more out of it than I ever give. I know that for sure. The little kids that we see and the poverty that we see, it's really eye-opening.
So the kids are how old?
Oh, they're anywhere from 2, 3 to maybe 18 years old.
And what do you mainly do? Pulling little teeth
You
that are
know,
infected?
we do remove a lot of infected teeth, but we've actually, through friends of ours, been able to get dental drills and stuff like that, so we fill cavities, and then there's a lot of people that end up coming off the street that we end up taking care of also. So it's real fulfilling.
So how many do you see in a day when you're working?
Oh, I think there's 120 at the orphanage, and I know we've seen up to about 100 people. So it's really great. We
it's a
enjoy
great
it.
gift. Have you had a chance to be
I
here?
haven't gotten to go yet.
Yeah, we were
no.
just talking about that
Yeah.
on the way down here, that you'd like to go.
Her opportunity to give.
Yeah.
And they pay you big time down
Yes,
for this.
yes, it's they pay very well.
Yeah. Well, I mean, you know, it's this going to heaven reward is one of those things.
Yeah, that's right.
Yeah. So, well, you know, what we need is to have some people call questions to you. We are excited to have both of you here, and we're also excited to receive your questions or comments as they add so much to our show. You may call in at 1-888-376-6225, 1-888-376-6225, or you can submit them at oncalltelevision.com and click on the questions button. We need your calls. Think about it. Call early so we can get it on the line. Let's just start out with some really good general questions, okay? We've got little kids in poverty. Their biggest problem is probably they don't brush, they don't floss, and their nutrition is bad. What else goes on with this group in Haiti or in an average Watertown kid group? I mean, what's the biggest problem?
I would say home care is one of the biggest things. Like you had said, the not taking the time to brush their teeth, drinking a lot of soda is another one of the big ones that we see.
How bad is that? How bad is drinking soda?
That's the worst.
It is.
Yeah.
That's one of the biggest causes of the cavities that we see in our office. I would say
That's the sugar.
the people drinking the sugar with the acid and, not brushing and flossing, and that acid and sugar kind of sets on your teeth and starts causing those cavities to form.
A common thing that people say is, well, I drink diet soda, but that still has acid. So if you're still drinking the acidic soda, it's still going to cause your teeth to decay. And sometimes you don't know that, you know, so it's just our job to kind of point that out.
Another thing, what too is with like the Powerades and Gatorades and things
Yeah,
like that, those
is that
are
better?
still
Maybe not so
not
much
a whole
acid.
lot better. Not as much acid, but still a lot.
Still a
A
lot
little
of
bit
sugar.
better.
Yeah.
Yeah.
Little better, but
How
still
about
lots of sugar.
how about the diet-free? I mean, the sugar-free diet. You know,
still has
water.
sugar. Oh,
Water?
the water.
The water that has a flavor of something. You know, the artificial sweeteners. Are they hard on the teeth?
No, I think the acidity on those are
Low.
fine, and I think those are a great adjunct to having something other than bland water to drink. But water's the best if you flavor it. I don't think that makes any difference from an acid standpoint.
One of the
does
big
it?
things too is if you are going to be drinking the soda or the Powerades, it's best to just sit down and drink the pop with a meal or at one sitting instead of sitting there and sipping on it throughout the day. Because if you're doing that, your saliva just doesn't have a chance to kind of wash away all the sugar and acid that's sitting on your
How
teeth.
important? I mean, I've often heard that saliva is a tremendous help for a person's teeth. Actually, for pharyngitis. In fact, my biggest thing is sugar-free cough drops to make saliva so that it washes this, the pharyngitis and cleanses the back of the throat. And I've heard that if you had radiation therapy to your mouth for a cancer or something, you can just count on the teeth falling out because the saliva is so important. What's your comment to that?
The saliva flow it's a huge deal. Even at night, the saliva flow really decreases.
Saliva flow.
Yes.
Well, when you get a dry mouth, there's nothing to rinse away the any
bacteria, yeah.
and if you eat before you go to sleep, that's something that's going to stick to the tooth and start the process of dental decay. But it is true, when you do decrease the amount of saliva flow in your mouth, you really have a hard time. And people that have had radiation therapy, they're really up against the wall with that. And there's a lot of adjuncts that you can help with increasing saliva, and I don't know the success rate of all of them, but it's a tough road with that.
Yeah, I mean, there are a lot of people who have dry mouth and they don't have any radiation therapy.
There are a lot of medications.
Well,
that
let's look
cause
at it.
the dry
The
mouth.
medication, the big medication is the bladder medicines. I hate the bladder medicines because it dries up the tears, it dries up the mouth.
Yeah.
It really constipates people. But there are others. The diuretics dry you out some.
Antihistamines, high blood pressure medications.
The decongestants.
Yep,
Yeah.
decongestants.
And that's why a lot of people say, I can't believe I am getting cavities now. I haven't had them for years. And one of our first questions are, have you started a
new
different
medicine.
medication?
Yeah.
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 So antihistamine with decongestant, bad.
Yeah.
I think the antihistamine, the Sudafed, is a bad medicine. It's used, and it's used. It makes people weird anyway. So I just don't prescribe it. Although I can tell you, the allergists and the ears, nose, and throat people that are on the show, they do. They love it. They say, well, you got to use it sometimes.
Yeah. A lot of the times the benefits of the medicines obviously outweigh the risks. We just kind of have to treat the symptoms of the dry mouth.
So what can I do if I have a dry mouth besides not take the medicines that dry me out, and if I have an immune system problem? And you said sucking on throat lozenges sometimes makes saliva flow, but sometimes it's inadequate. Are there replacements? And the answer is
Yes, to a certain point.
And what are they?
They have different products out there that are made specifically for dry mouth. They have a biotin product. They have the toothpaste and the mouth rinse and
Biotin?
Yep.
And that's the name of it. And it's over the
Yep.
counter?
It's over the counter.
And that
Yep.
would be your recommendation?
That's usually what we recommend.
We
do
do.
you know of anything else
No.
any other products?
No, I don't. But I do. When someone comes in and they are complaining of a dry mouth or they're getting cavities, we always also, with the adjunct of the biotin and those products, we talk to them about make sure you go to bed and the last thing you do is brush your teeth and rinse your mouth out with a fluoridated mouth rinse. Do what you can to put the good stuff on your teeth so that you don't have any carbohydrates breaking down on your teeth and starting that decay process. So as far as building tooth structure back, and that's not something that we are going to be able to do, but to stop that process, that helps.
All right. Okay. We have from here in South Dakota, lady has sensitive teeth for 2 to 3 months using sensitive toothpaste, but what else can she do? I know that somewhere while you're growing up, all of a sudden your teeth get sensitive or cold. You drink something cold or something hot and you go, oh my gosh, it really hurts. So what makes sensitive teeth? Is there always something bad going on? And is it just something as you get
That
when
is
you
one
age?
of the biggest complaints that I think I would
I
probably
agree.
get. There's a couple different things that can cause that too. One of the biggest causes of the hot and cold sensitivity, I would say, is recession of the gums. When the gums kind of recede down and the root gets exposed. And when that root is exposed,
You're in trouble and it hurts.
yes.
But
But
what can I do? I mean, everybody gets that when you get a long tooth. When you get older, right? You can
Yeah.
tell how old the horse is because the tooth
Yeah.
has had receding gums.
we
Wow.
talked
How do
about
you
the
stop that?
sensitivity toothpaste, and there is kind of a new system out there using lasers that what that kind of does is plugs the channels that are exposed on those roots, kind of creates a plug on the end of the channels.
And takes the pain away.
It takes away the hot and cold sensitivity.
What about bringing back the gums? Can I get the gums back? I mean, I
In
guess there's
some
surgery.
circumstances you can, yep. There's tissue grafting that can be done. That would kind of be one of the more extreme,
The last thing to do.
a last resort. Yep.
Okay, so if the wisest thing we could ever do is to get people not to have receding gums, right?
Mm-hmm.
What would be the way to do that?
Well, there's smoking is a large contributor to receding
Really?
gums.
Smoking recedes the gums.
Yep, it decreases the bone, the blood's flow, which decreases the ability for the tissue to stay healthy. Getting your teeth cleaned regularly to make sure there's no buildup underneath the gum tissues will help allow the teeth to, the gum tissue to stay healthy. That inflammation will start to draw that bone down.
So, so brushing twice a day and particularly taking time brushing the gums. Flossing.
A lot of the times people are really aggressive brushers too. You don't need
Too much brushing.
too aggressive, or even when they're brushing, they're pushing way too hard, a lot harder than they need to. Just kind of let the brush do its work.
Okay, let's talk about brushing a little bit because Okay,
These
so my
electric toothbrushes
Yeah, what do you think?
are great.
Oh, they're great.
Yeah.
So my dentist, my hygienist said, okay, this is what you want, and here you are, and it's only going to cost you X amount, and it'll cost you the same amount in the other store. Here's what you want to do. So I'm doing it, except how aggressive do you go on that? That's the other question.
Kind of just let the brush do its work. I would say you don't need to add a whole lot of extra force.
Just move it all around.
Yep.
Yep, just let the.
And you
brush
like
go.
this.
Yep.
All right, and there's several different brands. Is there a brand that you particularly like?
I like Sonicare.
I have a Sonicare
that's
too
just
that
what
I
I
use.
have.
And what is this? This is not a Sonicare. This is Professional Care Braun. But you
That's
like
the-
Sonicare.
I think that's the Oral-B one.
Yeah.
That's an Oral-B.
And
I'm
I've
sure
had
it
that
works
and liked
fine
it too.
also,
Yep. Yep.
And if you're talking about toothbrushes, what kind of, this is the Oral-B
Yep.
toothbrush.
You want to get a soft toothbrush. The ones
Never-
with the hard bristles.
I mean, they've got
can
hard
cause that
bristles for some
recession.
people, don't they?
Yeah.
Yeah.
Why?
Yep. You know,
I don't know.
I don't
why
know.
they do.
stick with the soft.
Yeah, I would go soft.
Okay, so I was told, I said, I hate to floss. I hate to floss. Well, okay, some people get by with Jordan sticks or tooth picks that cleanse out in between instead of the floss, and also the water pick. People talk about water picks. What do you think about water picks and toothpicks and floss, and what's your story?
My opinion, I would say that flossing is the best for sure. Just
Because
it gets down between where the teeth come together. Your brush can't get there, the water pick can't get there as well. Toothpicks can't get there, and that's a lot of the times where the bacteria are kind of hiding and want to cause the cavities, and that's why flossing is so important. Kind of gets where nothing else can get. So the water pick is really good for people that have braces to help kind of clean around the braces too.
Okay.
For sure.
All right, any feedback on that? Good old
I
regular
agree.
hygiene. Okay. Twice a day brushing.
Yes.
Everybody used to say 3 times a day. It's even better.
3 times a
It
day is
doesn't
great.
hurt to do it after your meal.
Yeah.
Okay.
Before bedtime, I would say is the most important, like we had talked about.
All right, and then if
Yep.
you get up in the night and have a snack, brush your teeth again.
Yeah.
Yes.
Absolutely.
And if you take those special high fluoride mouthwashes, what about those?
Well, I like
Yeah.
to do that one time a day right before you go to bed. Yep, so the fluoride dries on your teeth.
Okay. All right.
One thing too to add to that, that I never knew was after you brush your teeth, they say that you're supposed to just spit out the extra toothpaste and just kind of let the rest of it set. You're not supposed to rinse it out with water because that fluoride is kind of setting on your teeth and doing its job too.
So don't rinse your mouth so much.
Leave that gritty. Yes.
Paste on your teeth. I've
Yes.
thought about that because
Yeah.
but I haven't followed through on that. I
Yeah.
might just change my habit. That's it. Okay, from Lennox, 60 years old and still has wisdom teeth. Should I be concerned? No problems yet. What about removing wisdom teeth? My daughter had her wisdom teeth and she was pretty sick for a few days. You know, I can remember being pretty sick for a few days after my wisdom teeth were removed.
And it's nice to be able to do it when they're young because they're not developed. When we're looking at them on the x-ray, we always say when they're 2/3 developed because then they come out so much easier. But when you do get to be 60 years old, they're fully grown, and you would have to look at the actual x-ray to say should it come out or should it stay. Sometimes if they're completely embedded in bone, sometimes the risk versus benefit isn't worth it. But I do think they should always be viewed on an x-ray because you can get something called a dentigerous cyst around that tooth. So every 5 years, we like to take a large x-ray called a Panorix. Yeah, and so it should be viewed, make sure that it's healthy. And if it's causing problems with the teeth next to it, then it should be removed.
And the cyst is a bad thing
A cyst is a bad
because it can have infection.
Well, bone destruction. Even if it's not cancerous, it still can cause structures to.
A lot of the times for the teenagers that we recommend too, it's more of a prevention from causing problems later on down the road too.
Right.
They can start coming kind of up at angles, and food can get caught behind the back teeth and lead to
Squish
bigger
your
problems.
teeth and get them out of alignment.
And it's just so much easier
Yeah.
to do
Get-
it
when they're
younger.
young.
Get
Yeah.
them out when you're young.
Yeah.
Okay,
Yeah.
well, we're going to move to the next, this. Dental care is very important for growing children and youth, but not everyone has easy access to a dental office or the insurance to cover the expensive costs for fixing painful cavities or other dental issues. Thankfully, through a nonprofit program here in South Dakota, there is hope and a way to meet those dental needs without dental insurance.
We've been working with the Dental Mobile since the start back in 2004. We've been a partner with them up here in Watertown every year, and we've also started a partnership down in Madison the past 2 years with them. We collaborate with the Women's and Giving Foundation here in Watertown, and that helped pay for some of the stipend of bringing the Care Mobile here, and United Way down in Madison. Here in Watertown, we've done close to $200,000 worth of care just in the, once yearly visits here, which is amazing. They see usually 60 to 70 patients in a week's time, and so, and usually do around $25,000 to $30,000 worth of care. So the value is just astronomical. It's a huge benefit. There are schools that they do partnerships with also. They've really connected a big link in education and oral health. Kids are missing a lot of school because of oral health, so therefore it affects their learning. So with getting them in, getting preventative care to them at an earlier age and access to dental care helps with their education. They do oral cleaning, they do the fixing of cavities and all of the dental work. They also do a lot of instruction and education, not only to the children but to the parents, and so that's a really huge value to the program. They talk to teens about tobacco use and using chew and what that does to your oral health, things like that. So it's a multitude of services that they provide.
I know that they wanted to see a dentist because it had been a couple years, so I think they're just grateful that they were able to get in. We had dental insurance up until the last couple of years, and recently my husband passed away, and he always carried the dental insurance, and we do not have any right now. So I was excited to get them in to have appointments with the Care Mobile. I just want to thank the Dental Mobile for doing this for families that are unable to have dental insurance, because it has just been awesome for our family to not have to worry about trying to find a dentist without insurance.
And that Care Mobile, that's a good thing. It goes all over the state.
It's a wonderful
It
thing
is.
for access to care and individuals that weren't getting care to begin with. It's a great
Great
thing
effort.
thing.
Our hats off to them. Well, join our conversation and call in your questions or comments about tonight's topic on dental health. Call 1-888-376-6225 or email them to questions@oncalltelevision.com. And we thank you for your questions. So there's a great deal of people who don't have dental care. They have bad teeth, they need help, and they can get it there. They don't always get it there, though. I mean, what would a person do if you're living in a community anywhere in South Dakota and you had some teeth that are going bad or falling out, or you just need help?
Go ahead.
For kids, every February we do give a Kids a Smile Day. We do it in Watertown, and I'm sure they do it all across the state. And we give away free dental care to anyone that doesn't have insurance or no other way to pay for the treatment. And that's a really good option that's underutilized, I think.
Yeah.
And there's a program for adults, like donated dental care, that allows people to get care that aren't able to do it financially also, and those are neat programs.
How about dentures? That's a high expense, and there are many people who really need dentures. That's expensive, and they don't have the money. Is there any option for them?
Something like a donated dental. There's a lot of organizations out there, I think, if you look into them. And then, there's a lot of people out there just willing to help if they come in and they're in a situation that they're not have the ability to do it. You know, we're all human and want to make sure people are taken care of.
That's great. One of the people in the production room asked about ACT, the mouthwash for building enamel. It advertises that it builds enamel. Now, what is enamel?
Enamel's the outer covering of the tooth, the pretty part that when you smile you see that white. Underneath it is dentin, and then you have the nerve canal under that. So if you keep your enamel intact, then you have a very healthy tooth. But that's the process where decay starts to break down. Rebuilding it with ACT fluoride, I don't know that a rebuild. It will maybe help. Would you say replenish it?
Strengthen the enamel that is there.
But it's not going to rebuild.
Once the enamel is gone, it's gone.
Yeah.
You can't get that back.
So to protect my enamel, because it sounds like I need to do that.
Yes.
I need to keep the bacteria from eating it away.
One of the other big things that we see wearing away the enamel is clenching and grinding at night.
So what do you do for clenching and grinding? I have
Night guards.
Night guard. I think everybody in our dental office has a night guard.
We all have
Oh,
one.
is that right?
Yeah, I think
We
they
all
have a
have
hard time
one.
working with Amber. And yeah, no, everybody in our office I think wears a night guard. I know I do,
Can
or
you
I
buy
should.
one over the counter?
Yep,
I mean, it's
there's a couple
can.
options. Yep, there's some that are over the counter wherever you shop, Walmart, Target, Walgreens. The other option is we can make them in the office. You can come in and get an impression, and then that way it's custom made for you. A lot of the times it's kind of you get what you pay for. With the custom ones, they fit better, they're more comfortable, and if they're more comfortable, you're going to wear it. Doesn't do any good sitting on your dresser.
How do I know that I'm grinding my teeth? I mean, your partner in the bed says you're going.
That's one way.
That's one way. Your dentist will often be able to look at your tongue, and if it's kind of stifled, you can tell that they're clenching and pushing their tongue out towards their teeth. You have little things called wear facets where the enamel is worn out, but you can see the dentin. There's a lot of tooth sensitivity that goes on with clenching your teeth also. So
People who have sensitive teeth could be grinding.
grinding, clenching your teeth.
One way for you to tell too at home is when your teeth are naturally forming, they have hills and valleys in them.
Right.
And if those hills and valleys are kind of
Flattening out?
Yep,
Bad
that
sign.
might be a sign that you're clenching or grinding.
So
or waking up in the morning with jaw pain, headaches, muscles are tired,
all
things like
contributing.
that. Yep.
Tympanic membrane syndrome, TMJ, tympanic membrane, or temporal mandibular joint pain.
Yep.
What's that all about? Is that related to the jaw clenching?
It is, and it's a little more involved. And sometimes just a night guard isn't going to take care of that either. And I know in our office, we often will refer them over to the orthodontist and have them take a look at it and make sure that it's aligned right, and if they need to do a positioning splint. And that gets a little more involved with just more than clenching your teeth.
But it might be related to...
Often is related to
Right.
it, yeah. It's usually the first thing you think about when you're getting that pain.
Right. We have a caller from Hot Springs. What are your thoughts on sugarless gum?
I love it.
Yeah.
Yep, I chew it all the time.
Yep.
You
We
know,
do in
And
our
I think it
office.
stimulates your saliva.
Exactly.
Yeah, I think
Makes
we go
saliva.
through that.
Yep.
Yeah.
And it cleans your teeth, and it eliminates some of
Yeah.
that. I read an article. Of course, the article was sponsored by one
Orbits,
of the
or-
yes,
Yeah.
one of the gum people. But they said there's some data the data, and they showed the data. I'm being critical of it because it's sponsored by the gum company, but it shows that people did better, had less cavities, had better teeth from
That's
sugarless
probably
gum.
from the saliva flow. Yep.
But there is if you are a clencher or a grinder, that's something, one of the first things we'll tell you not to do is work that jaw anymore.
Yeah.
So there are times
Yeah.
where gum tissue, the gums can be more harmful.
Okay, I tell you, I chew gum for, someone hands me some gum, I'd like to chew it,
Yeah.
and I have the nice flavor thing, and after a while, the way I chew it, and my jaw is
Yeah.
tired, and I go, why am I doing this?
At that point, you need to stop.
Yeah.
I'm one of
And
those.
you've gone
Yeah.
too far.
Yeah. 86 years, is it okay to pull a bad tooth instead of doing a root canal? Good question. I had somebody ask me that a week or two ago in my office, do I need to do a root canal? Can I just pull it? What's the importance of saving that tooth? I don't have all that money to do
They're
it.
86.
And they're 86.
There's a lot of things that you need to look at before you do a root canal. You got to make sure that, first of all, the bone level is adequate around that tooth. is there enough tooth structure? You can get the tooth out of pain, but is there enough tooth structure to build up around it? So if you have a really good tooth and it's, then yeah, I would try to save it if you can. It's not a life or death situation, but anytime you remove a tooth, you place more force on all the other teeth, and so if you can save it,
that's
better.
it. All right, you're an implant specialist in one sense. You do a lot of implants. Tell me about implants and explain to me this illustration that you
That
brought.
kind of goes along with taking the teeth out.
Yeah.
Yeah, it does. I never leave home without this.
Okay, so
But this, and you know, I'm a dentist that does implants. It's not necessarily a recognized specialty, but this is something that shows the progression of bone loss once you lose teeth.
So this is a normal jaw with teeth,
With teeth.
without teeth, and then once they're gone, boo-boo, boo-boo.
Yep. You're
Your jaw
born
goes
with
away.
this right here with basal bone, and as your teeth grow, so does the alveolar bone. And once you have a full complement of teeth, you have a nice alveolar bone, basal bone on the bottom. And as you remove these teeth here, you start to lose this alveolar bone. Alveolar bone is the only thing that's around only if you have teeth or a dental implant. So if you come in and you have all your teeth, but they need to be removed and you're thinking about doing dentures, you're going to eventually go through this process. And when you get to this process, here you can still do dental implants and stop that progression of bone loss. Here you can also. Here you're getting into a situation where implants are a lot more difficult. And then you have problems with your nerves sitting right on top of your jaw, and that causes a lot of pain with your dentures. Right here, your denture fits really nicely. Most people's dentures...
One thing is too, even if it's just a one tooth that you take out, it still causes the bone loss to happen. So doing implants will kind of keep that pressure there in the bone and keep the bone level up.
We have some pictures. Let's look at the pictures that we have. See what we. There
This is a progression. What it looks in goes along with. This is what's happening intraorally in your mouth.
This is normal.
This is normal.
The next one.
And this is a progression as you lose your teeth, and it causes an aging process in your facial structures. And when you get to this area in the next picture, it really ages the face. So what's going on inside the mouth is portrayed facially, extraorally like that.
So it's a good idea to keep your teeth and it
Yes.
keeps you a little bit younger.
Yes.
Yep.
So good reason to brush your teeth and push your kids to brush your teeth and not have to go to Dr. Slate, my doctor from D. Smith that I grew up.
Dr. Slate.
Oh, what a great man he is, and he just passed away this year, and it just broke my heart. What a great guy he was. We've got a bunch of questions. We've got 1 minute, and then we're going to take another package. What do you think of topical fluoride treatment provided by the primary care provider or dentist in the first year of life?
In the first year of life.
You're talking about topical fluoride for these little kids with new teeth.
The one thing about fluoride is you want to make sure that you're not swallowing it. So when anytime you get fluoride on the teeth, that's great, but you want to make sure that they're not ingesting it.
Yeah, make sure it's a regulated dose for sure.
We always talk about that with when you start using a fluoridated toothpaste, that they are
But
that they're able
swallowing
to
it,
spit it out.
what happens when you swallow it? It gets into your bones?
That's a good question for you.
Well, it gets into your bones. It makes them brittle, so you don't want to do
Gives you
that.
a tummy ache too.
Yeah.
A tummy ache.
Yep.
All right. Well, we don't want those either. No, we don't. Okay. Well, there are foods that are good for your teeth, and there are foods that are not so good. We know excessive sugar in our diet is detrimental to our general health in many ways, but it's a terror for our oral and dental health. We can do better by including food from groups that contain minerals to strengthen gums and teeth, and to brush after eating a sugary-laden snack. Maintenance is key. Your mouth and overall health will thank you.
There's different types of sugar. There's sucrose, there's lactose, those types of sugars. And so when they break down, the problem then that can happen with the teeth is that some of those sugars, in the mouth, they like to stick to the teeth. And so when that happens, then that's just a breeding ground for bacteria, and that can cause some issues with, dental caries, even issues with periodontal disease. You know, it starts in the mouth, and so you have your saliva to help mix with your food, and then there's an enzyme in your saliva that helps start to break down the carbohydrates. Brushing is an immense help. That can really remove a lot of those sugars. And actually, even drinking water, you know, after your meal especially, can help rinse some of those sugars away. Another thing that's recommended is to kind of avoid the continual grazing of sugary type foods. Say you're somebody sitting at your desk and you like to sip on a, you know, full sugar soda. I won't name a brand, but let's say you're doing that all day. Well, you just have that constant, you know, sugar coating on your teeth, and that can cause issues. So if you are going to eat your sweets, you know, go ahead, eat it, be done with it. Control the portion size, if you will, and then you can really help yourself by or drinking some water, and then help yourself even further by brushing. And as far as dietary things that you can do to help your gums is to make sure that you're consuming, you know, adequate amounts of vitamin C, which is very helpful for gums. Make sure that your diet has a source of fluoride, and our source of fluoride typically is in our water supplies or our tap water supplies. If you're in an area where you don't consume tap water for whatever reason, and you're just consuming bottled water, you may need to talk to your dentist about fluoridated water or even possibly fluoridated supplements. But make sure that you talk to them first instead of just going out and buying fluoridated supplements. There are issues with individuals, or it has occurred, where over-fluoridation or too much fluoride can cause some issues with the teeth. Folks with dry mouth, for whatever reason, they can be at increased risk of having dental caries because they don't have the saliva to kind of help, you know, wash away some of those sugars and start to break down some of those sugars. So sometimes, you know, the sugar-free candies can sometimes help stimulate saliva production, keep things moist. Another thing that's really helpful is, you know, again, drinking the water, but consuming fresh fruits and vegetables. That can help stimulate that saliva production as well. It's really important if you have infants or even toddlers that you're not putting them to bed with a bottle. Because what happens then, they have long periods of time where those sugars are just, you know, sitting in the mouth, and that can cause some very serious decay. Even if the infant doesn't have teeth yet, the decay can start to occur on new erupting teeth, or it can, you know, really affect the gums. And it's very important, even if the infant doesn't have teeth yet, that you protect those gums so that, you know, it's a good situation when the permanent teeth do come in.
Great issues about the value of proper food and how to get your kids to not be sucking on a bottle and exposing their new teeth to sugar all day long. Join our conversation and call in your questions and comments on tonight's topic, 1-888-376-6225. Did I say 4 8s? It should be 3 8s. 376-6225, or email them at oncalltelevision.com. Let's run through some questions. Okay. Sioux Falls, third tooth from the back pulled, doesn't want an implant or a bridge due to cost and extreme pain. What are some other options? Like, what is a flipper tooth?
Third tooth from the back. A flipper tooth is something that is mainly just for cosmetics, that you show that you have a tooth.
Yeah, like a denture.
Yeah, it's something that's removable. It stays in, but you can take it in and out.
And it really doesn't function.
You can chew on it, but it's more for
looks.
For looks.
We were talking about dentures. Dentures is a big problem with many people, particularly the lower dentures. And you told me that there are people who will come in and they've just had a set of dentures. They don't like it. They want you to find a pair that work. And your answer is?
Well, I see a lot of individuals when their bone gets to this point, and I just say...
To this bottom.
Yep, to this bottom one, or this one here. And their first denture fit great, but they haven't been able to get one to fit after that. And the most common reason is because they've lost that bone. So to be able to hook on to anything that doesn't work. And that's one of the biggest treats for a person when they get a dental implant and their dentures actually snap in.
So the implant is only an attachment for your dentures.
Yeah, the implant goes in and it'll maintain the bone where it's at, maintain the bone where it's at, and in the inside of the denture you get two little things called a housing, and that snaps in, and then they don't move around. And these two little implants, of all the different implant modalities that we do, the people are so excited with these. It's such a life changer when they can get.
But I can have, if I lost a tooth, an implanted tooth that looks just like the tooth that I lost.
With the crown on top.
With the crown, it's the same little snappy thing and a crown that fits on top, and you can take it off, or does it just
Nope,
stay?
that stays in. You shouldn't be able to recognize it if it's a natural tooth or an implant.
So you screw it into the bone. I mean, it's, you know, don't you get bone infections sometimes with that?
You know, that's always one of the most common questions, and I see very little bone infection with implants. You have to have a certain protocol, but infection and pain are two things that most people think they're going to have, and I would say 95% of the time they say, oh, that was a lot easier than what I thought.
Okay, I've got one other question, and then we'll get to these questions. Fosamax. A lot of people are put on Fosamax because of osteoporosis. I know there's some concern about Fosamax and necrosis of bone and infection in bone and so on and so forth of the jaws. What's your take on it?
That's something that I'd say about 5 years ago I seen that start coming out more and more as more people were using it. And it's something with dental implants and surgery you have to be aware of and work with the physician. I have many patients out there that have Fosamax, and the oral type of oral bisphosphonates is what they are, and you can do it, but you have to go through a protocol and work with your physician.
Be careful with it. Amber, any more thoughts?
He covered it.
Selby, sore mouth all the time, gargle with salt and water. Is this okay? What's the concentration of salt and water?
That's a good question.
Well, my answer is it should be saline. And the right amount of salt for saline is about a teaspoon per gallon, maybe 2 teaspoons. The problem, what my dad used to do is he'd be 1/3 salt and 2/3 water. I mean, it would be so salty that it would draw out the normal tissue. It would be the opposite. It would be destructive.
My question would be, when was the last time that they had a cleaning? Because a lot of the times the tartar and plaque can kind of set underneath the gum tissues that they can't get clean, and that can cause that sore gum tissue too. Yeah. Absolutely.
Absolutely.
I really lean on my hygienist.
Yep.
Robin Williams, not the comedian. She's wonderful. A shout out to Robin. Thank you for all that you've done. Sioux Falls, comment on how Fosamax or other, we just did that. Belfouche, collar has dentures that don't fit well. Can the DD dentures be refitted without having to start over? The DD. The old dentures be refitted.
Often someone comes in with a newly made denture, and I can add implants to them and reline underneath of them.
Wow.
And
One
use their
other
other
thing
denture.
too is if dentures are loose, as the bone starts changing, we can do a reline of the dentures too to try to make them to fit a little bit better.
So you don't have to start from scratch?
Sometimes no.
Okay.
Sometimes yes.
Del Rapid, sometimes yes.
Yep.
Del Rapid, 71, value of fluoride, positives and negatives.
Very positive.
So, I mean,
Yes.
I don't... Go.
No, you can go.
No.
I was going to say fluoride's very, very important, especially for kids when their teeth are developing, for sure. It helps strengthen the enamel, which down the road leads to less and less cavities.
The fluoride in the water. So
Water,
people should
for
be
sure.
drinking not bottled water, but water from the
Absolutely.
tap.
Yes.
Your comment, too.
I
Do
agree.
you agree?
South Dakota, 59. What toothpaste do you recommend? Are they mostly the similar or just personal preference? The ones with fluoride you want? How about the ones with
Fluoride for
abrasions? Whiteners?
It's all personal preference. The whitening is going to cause more sensitivity to hots and colds. The tartar control can cause more sensitivity because it's more abrasive too, but kind of personal preference as long as it has fluoride.
Okay. Rapid City, 68. Have heard of the pinhole technique for gum restoration. Thoughts about it? Lady has had a grafting and was unsuccessful. Pinhole technique.
I don't know a whole lot about that.
You've heard nothing. You know pinhole technique? Pinhole. I don't know.
For gum restoration, I haven't heard of it.
She's had transplants and it didn't work. So
Yeah.
is there? What else happens if your transplant doesn't work?
Where they've added
gum.
gum
The
tissue.
gum tissue, tissue graft.
I haven't heard of the
I would
pinhole
refer to
technique.
a periodontist.
Periodontist.
Yep.
Brookings, Erin Peterson, call her name, I shouldn't have said it, 23 years of age. Is it better to floss before or after brushing?
We've talked about that in our
Yeah.
office, just me and the
I think if you're
hygienist, too.
flossing, but I do think they do say if you floss first, isn't it?
I floss first.
Okay.
That way I can brush away everything that comes out between.
Oh, okay. Haywarden, Iowa. Shout out to Haywarden.
8 miles from my hometown.
With a hand toothbrush, do you brush the way the tooth grows down or top teeth and up on the bottom teeth, or which is the technique? And are the wishbone-shaped plastic floss devices good? They make it so much easier to floss.
I love those little
Yeah,
flossers.
I do too.
You like the little flossers? And
When
do you
you're
brush
brushing,
down or do you brush?
Don't pull up and down like this. That can help progress that recession.
So you brush away from the
Well,
gums.
if you have an electric toothbrush,
You don't
then
need to
should
worry
just
about
let
it.
it do
Let
its
it go.
work. If not, I would try to do circles or kind of more front to back.
Okay. Brookings can't wear lower dentures anymore. Over 30 years of age, was told in order to get new ones you had to have implants. That's it. We answered that. Sioux Falls, how safe for getting x-rays if you've had radiation before? Should you still get them every 6 months?
We were just talking about this on the way down.
Yeah, how much radiation?
Once a year, we do x-rays once a year, unless there's other problems that come up. I have read studies that say in your exposure for a year, dental x-rays are 0.2% of
all the
of
x-rays.
exposure. And now a lot of the offices have the digital x-rays
Digital,
too.
traditional.
Much
that
lower,
90%
less.
less exposure. Yep.
So not much radiation.
They're very important. They show the cavities when they're small, and that's when it's
Yeah.
good to fix them.
CAT
Yep.
scan of the body is 100,000 times as much exposure as your mouth.
Yeah.
Sturgis, 60, comment on sleep apnea devices instead of the CPAP machine.
There's been a lot of studies going into that, and a lot of dentists that are working with physicians with a mouth appliance, helping to position the jaw to allow them to breathe better at night. What is your comment on that?
I don't know enough about it. I do know that some people can't tolerate CPAP.
Yeah.
And the devices can work, and you can pay big dollars for them, or over the internet, some people get success. I think it's a trial and error deal.
Yeah, and my big comment is I think a sleep study is something that if you're doing that for the reason of sleep apnea, that you have a sleep study with your appliance. That's my opinion.
Fluoride varnish,
Yep.
you like it?
We do it on a lot of the kids.
So you put this varnish that protects. I mean, there's such a difference
Yep.
in teeth. You look into people's mouths nowadays, and there's no cavities. You look at mine, and it's all little spots of black. Cracked tooth. What do I do with that? Can I fix it? You just wrap it with a piece of wire and keep it from falling apart, right?
Yep.
Yeah.
Super glue.
Yeah. A cracked tooth usually goes in 3 stages, and if you can keep that crack and get it crowned before it goes any deeper, that often you
So,
can fix
so
it.
before, so crown it is what you're
If
saying.
you start getting biting pain, try to get a crown on that right away. Otherwise, it'll go
gets
into the
into the
nerve,
nerve,
and then
yep.
it's root canal or crown. If it keeps going, it's removed.
Oftentimes crowns go on, and then you end up with a root canal. Does that always happen?
No.
Does it have to happen? It can happen, though.
In a situation like that, that's quite common if you have a cracked tooth.
We've got a few seconds. Do kids have constant access to a sippy cup of milk or juice increase their tooth damage or cavity risk?
Yes. Yep.
Yes.
They're constantly, if they have a sippy cup, they're probably all day long, they're drinking that milk or juice, and I would really limit the juice intake for sure.
Juice,
Absolutely.
Yeah.
milk instead, and not a sippy cup all day long. How about a pacifier with fluoride in it?
If you can invent that, that would be great.
All right, well, we'll be right back after this.
The flu bug is getting ready for another season. Are you? Get vaccinated, because stopping the flu starts with you.
Lately, carbohydrates have been getting a bad rap. For the most part, if you break down everything we eat, it can be protein, fat, or carbohydrate. Carbohydrates are defined as sugars, either simple and sweet or complex and starchy. Sugars, or saccharides, are the component in food for giving quick energy, the backbone for RNA-carrying genetic codes, and the building blocks for the body's immunity, fertilization, blood clotting, and more, and on and on. But there can be too much of a good thing. Take, for example, Halloween, a time for dressing up like ghosts and knocking on doors, imploring to trick or treat, maybe treat or trick. One study in Atlanta found the average kid went to 15 houses and gathered 60 pieces of candy, amounting to about 1.5 cups of fat and 3 cups of sugar, or 4,800 kilocalories. That's about 3 times as much calories as one would need for a full day of vigorous child play. It's enough to make a kid sick, and I, for one, have gone down that sticky path at least one Halloween in the past. Indeed, there are problems that come with too much sugar, starting as we chew it with our teeth. Experts tell us the moment sugar comes into the mouth, it begins encouraging a bacterial plaque coating of the teeth, which makes an enamel, tooth, and gum destroying acid. In short, too much sugar starts a cascade of mouth trouble for those kids that continues as they grow up. More trouble comes with after this sweet stuff is swallowed. Expert nutritionists advise us that the epidemic of obesity comes not only from too little physical movement, but also from the excess of sweetened, nutrient-poor, highly processed, profit-driven food and drink products being foisted upon our populace. It's no surprise that high-caloric yet nutrient-hollow food products and drinks are sweetened to encourage their purchase. Well, this is not to say that sweets are all bad. Fruits are loaded with carbohydrates. Rather, it's the quantity that matters. The best advice comes from my dietitian friend, who encourages us to eat nutrient-rich foods grown in a garden or an orchard, to enjoy a physically active life, and to savor the quality, not vast quantities, of a balance of food types, including carbohydrates. Remember, there can be too much of a good thing. Happy Halloween. Well, we've got a few minutes to finish up. 2 minutes. So take-home messages, smoking issues that we want to land on, or implant issues, or general dental positions?
For me, I would say that home care is the huge thing that's going to help prevent the cavities. Brushing and flossing twice a day.
And when do you teach a child to start flossing or brushing?
As soon as they get their first tooth. Even before they get their first teeth, you can be wiping their mouth out, getting all that milk or formula away from their gums.
Okay.
Yep.
And so teaching and
teaching them young. Yep.
So go in and brush teeth with them, maybe.
Yeah,
absolutely.
Parents need to play a role in the beginning for sure with brushing.
Just start it right away. Make it a habit.
Make it a habit.
Yep. They're not going to like it probably, but
no, I can tell you, I was one who didn't learn that lesson. And about implants, your business has a lot to do with that. Any take-home messages about implants that you would?
Well, I think if you start young with good oral hygiene, you can avoid a lot of the implant procedures that have to be done. But if you're already at a point where you have lost teeth, there's a lot of hope with dental implants to get that natural tooth back like you had at one time. And if you have dentures, it's a great way to fix loose dentures. So it helps with your oral hygiene.
Well, we really do appreciate you both coming down, and good luck in Haiti.
Thank you.
But you have a great trip and do a bunch of goodwill there for us. This brings us to the end of our show this evening. I sincerely thank Brian Prouty and Amber Meyer, our studio guests and friends, for helping to answer all the insightful questions from your audience tonight. Thank you for those questions. The great escape artist Harry Houdini, who died 87 years ago tonight, advised us No performer should attempt to bite off red-hot iron unless he has a good set of teeth. Until next time, stay healthy out there, people.
Funding for on-call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubak with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On-Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.